everyone, and welcome to the Joy and Jargon show. My name is Orlan, and today I have a great honor to interview Dr. Maurice Nicholson, a vet from Dublin who has worked for the last 50 years as a vet in the Middle East, in England, and also now in Dublin. Welcome, Doctor.
Thank you very much.
How
Nice to be here.
Yeah, thank you very much for accepting our invitation. So, as I said, I invited you today to talk about the language that you use that is specific to your work, and because you have to communicate a lot with public and professionals, I understand that it's very, very important. But before that, I'd like to know how do you feel today?
Oh, very well, thank you. Yeah, nice to be here. It's a kind of a wild and windy day out there, but it's great to be able to sit down and talk about my work and the importance of communication and language in it, because it's quite a big part, obviously.
Yeah. And so you, if I understand, you've been a vet all your life. Yeah.
Yes, this is my 50th year being a vet. You know, I qualified at a very young age at 22, and immediately I worked for a year in London, then back in Ireland as a farm vet for a number of years, and then I emigrated to the Middle East for a few years, where I worked in all kinds of practice out there. Then back to the UK for many years, mostly as a small animal vet in pet practice, and the same here in Ireland. So I've had a long experience of it. Yeah.
Oh, right. Okay. And when you decided to be a vet, did you have this goal to be a farm vet and a pet vet, or it was not clear?
It was never that specific. You know, I remember distinctly when I decided to be a vet, because my father used to buy us, my brother and I, this magazine called Look and Learn. It was kind of it was like a comic book for kids, except it was all about more educational things. And I remember reading an article in it about a vet operating on a cheetah in the wild, and that kind of got me all interested in the whole idea of it. So I was open to all areas of it, but I just decided very early on I wanted to be a vet.
And do you have a preference between being a vet for farmers or a vet for?
I think mostly I early on I was very keen to try all aspects of it, if you like. And so I did a year of pet practice in London once I qualified, and I think that was a very good starter, because you learn very early on how to deal with a large number of patients, and you immediately have to do various bits of surgery as well. So you get very proficient early on. Then I did some farm practice for 2 or 3 years, which is very labor intensive and gives you very little time off. Yeah. And that was always a negative, and it's against it. And so I've graduated to pet practice over the years, and in that to orthopedic surgery, particularly, which I made a speciality. But yes, I think I've been heading towards being a small vet most of the time.
It's worked with lots of different specialties. Have you noticed over the years big changes with the type of pets that people get, or is it mostly dogs and cats?
Certainly, mostly, yes. It's always been mostly dog and cats, and that still remains the same. Mm-hmm. But there are probably a lot more breeds available now, or different cross breeds available too, kind of more artificial breeds, if you like crosses between a Labrador and a Poodle, which are Labradoodles. They're a new type. Or between Cocker Spaniels and Poodles as well, which are called Cockapoos. So they've become kind of specialty kind of pets as well. So that has developed. But the biggest changes really overall have been in veterinary medicine itself, and the changes that have occurred there with improved science and improved, I suppose, availability of instrumentation and drugs and that. Yeah. They've made a very big difference to it over the years, yeah.
And so with this type of evolution comes different terms, like the name of the pets are evolving. Who decide that? Who chooses that?
It's a good question. I'm not sure. Obviously, I'm not sure who first decided to start those names, if you like. But anyway, yes, you see them coming in now, and that's what they're. It's noted on their identification that they are this new breed now, this cross between these two. Yeah, so they're, I suppose. Well, at the end of the day, all breeds are artificial breeds, because all the different breeds have developed because of, if you like, line breeding or inbreeding to develop a certain physical type, and that's always occurred. So if you go way back, I guess, in history and prehistory, the original dogs and cats were probably all fairly similar, and they've been bred for different traits over the years, and different types have evolved, and that's how you get all the different breeds.
And but as a professional, how do you deal with this change of vocabulary? Because you have to learn them to be a...
Yes, yeah, you do, but that probably would be that's easy enough, actually. Quite honestly, then every now and again you'll be fooled, all right? You'll talk to an owner and you'll say, "Oh, this is a lovely poodle," and they'll say, "It's not a poodle. It's a Labrador. It's something else poodle cross that I've never heard of before." So there are some breeds that and it's the same in the cats. Actually, there are lots of, years ago when I was in practice, 95% of the cats we saw were probably what we call domestic short-haired cats. So they're the normal cat you see. Yeah. Now, they might have all different colors, but they're basically all the same breed. Yes. Nowadays, we've got all these, strange breed, well, not strange breeds, but different breeds. Well, there's a ragdoll, one is called now, and then there's the
big one.
They're quite, and then there's the Maine Coon, which are really big ones. Okay. Yeah, really big. So some of these have become very popular, and but what has happened as well with some of them is that yes, they've become very popular, but because, if you like, some of them have originated from quite a small gene pool. Yes. They have, evolved with some health problems, because of the small gene pool they've arisen from. So, for example, Maine Coons have got certain health problems that no other cats have, and things like that.
Oh, right, okay. Is it possible to define what are the very key terms that really are essential in your daily work, like the terms that you use every day and you need to know and to be able to do your work well?
Yeah, there's no easy way to classify that actually in veterinary, because it's just too big a field that there would be a lot of, there's just a whole area of science, and scientific terms and medical terms you would know as you go through your study years. You would learn all these. Yeah. And as new ones develop, we all have to do a certain amount of refresher course every year to keep our degrees. So we learn all the new techniques and the new names all the time. Mm-hmm. And as well as that, a lot of the things we really need, I suppose, is we have to develop our communication skills over the years. And in some ways that's the most important way our language is useful to us, that we have to communicate with the client, because we deal every day with animals who can't tell us what's wrong with them. So we have to get all the information to the client. So our kind of communication skills for the ordinary person have to be very good as well.
Would you have some example of term that you use that specifically to communicate with your clients, especially to reassure them or to explain what type of issue their pets have?
Yeah, well, I suppose it's not so much there would be terms, but there would be kind of examples we could use. So, for example, quite often, it's not that the owners aren't aware of things, but suppose I did a small operation on someone's dog, and it's quite amazing that some owners would think, the operation's done, and and they say, "Can I take him for a walk tomorrow?" And I say, "Not quite." Imagine if you had your tummy just opened up today. You can't go for a walk. So I actually usually bounce it back to themselves and give them the human version of it. So I would say, okay, your dog has just had a hysterectomy. So if you had a hysterectomy, you would not be walking around for maybe 3 weeks. So you can have a little, just give her a little amble around the garden on the lead and that kind of thing. So I use human examples quite a lot for that.
Yeah, all right. Yeah, it does make sense.
Yes, yeah.
Okay, now let's see. Would you have favorite phrases that you use, that you like to use because, they are nice to use, or easy to understand, or they are very specific to your work?
They're not so much again, not so much phrases as just because again, it's just everything is so different that I think to each case, I suppose, that you meet is in veterinary can be completely different. Every time the door opens and an animal comes in, it literally can be anything because quite animals obviously an animal may have been suffering pain, we'll say, for a few weeks, and the owner may have noticed the animal wasn't quite right, but it mightn't have picked up that there was pain there. So quite often we see things that have advanced a bit, and so it's I think it's getting that message across to the clients is it's what's kind of important, that they pick up on things early, and they usually do, except they mightn't put it together. So I usually that's why when they come in to me with their pet, years ago I used to stand at my little examination table and talk to them about the animal and ask them some questions, and they tell me what they this is happening, or he's been vomiting the last 2 days, something like that. Nowadays I always have the clients sit down and I chat to them for a while and about the dog in general, and quite often they'll come out with things that might be a little bit innocuous in some ways, but actually they tell you an awful lot.
Yes.
Because the owners are with their pets 24/7, and they'd see little things, and they're used to their routines, and they might say something, just in conversation, they might say, oh well, I did notice that he's not jumping up in his chair the last few days, and that isn't a whole lot, but it might mean that he's got lower back pain or things like that. So you will get a lot of information like that, really, from it.
Yeah. Yes, of course. Yeah.
So it's a lot of the I think that's the main thing probably that's learn with experience, is how to the importance of the owner's observations, and also the fact that sometimes there might even be a bit of intuition in it. I don't know. I'll tell you the story, which is kind of an interesting one.
Yes.
This man came into me some years ago now, and with his dog, which is quite a young dog, I think 3 or 4 year old.
Okay.
And he said, oh, my dog, he's had diarrhea the last 3 to 4 days. I said, okay. And he says, and the first thing he said to me was, could it be cancer?
Oh.
Now, that might seem like a really, strange thing to say. And it is, actually. It's unusual for someone to say that. Now, because I see dogs with, vomiting, diarrhea, all these kind of things, virtually every day. And so if I had been a young vet in practice, I probably would have said something like, oh, no, I don't think so. He's probably gastroenteritis.
Mm-hmm.
It probably is that.
Yes.
But now, with some experience behind me, I said, I thought about it, and I said, it's possible, I said, but I think it's highly unlikely, but it's possible. Because he asked it, the question, I have to give him an answer.
Yes.
So anyway, as it happened, I took the dog in, we did lots of tests on it, and we tried to clear up this diarrhea, and we did some tests, and we found out it had bowel cancer.
Really? Wow.
So it is strange. So you learn to listen to people very well, never discount what they say.
No.
Sometimes it might sound that it's outrageous,
Mm-hmm.
but I would never discount them now. Whereas when I was young and foolish, I probably would have. So now I'd be more open to it's not writing anything out, and being more open to people and their own feeling about something for whatever reason.
Yeah, right. And it's a bit like a doctor with a
Yes,
yeah. But doctor, when we go to a doctor, usually they have a very, to me anyway, awkward language, and I'm like, what does that mean? What does that mean?
Yeah.
And with the vet, do you explain each term that you're using when it comes to the disease or any problem with you?
It is an issue, definitely, and so I always try and explain what it is, what I'm talking about. So, for example, if I think if a dog comes into me and it's, let's say, vomiting and showing signs of pain in its abdomen, and so we think it might be pancreatitis, which is inflammation to the pancreas, I would say to them, oh, listen, this is possibly what this is, pancreatitis. So to the average person, that doesn't mean much. So then I say, the pancreas, it does a lot of things for the body. It produces a lot of enzymes for digestion. So when it's inflamed, it's almost like there's some digestion going on in the gland because the enzymes damage the gland, so it's very painful. So I can explain it like that, So you have to explain things. Having said that, nowadays people are much more aware and educated about things like that because of the internet.
Yes.
And sometimes when they come into you, they've got a list of things asking you, could it be this, could it be that?
Yes, sure.
When I started in veterinary, that was not the case at all.
No.
And, and it's kind of an anecdote from my first year in practice, but I remember a Scottish vet I first worked for in London, and he said to me on one of my first days working as a vet, he said, remember, you're a young vet, you'll come across a problem you might know very much about because you're young and inexperienced, but you'll still know a lot more than they do. But nowadays that's not necessarily true because before, if people nowadays with the internet, if their dog's suffering from such and such a complaint, they'll check it out on the internet and they'll look at what else it could be. So, which is very good. So you can talk to them about that too, and if they got some knowledge, then you can interact with them as well, and that's helpful,
Yeah.
And they understand the tests you have to do and things like that.
Yeah, my parents' generation, for example, they wouldn't ask questions. Because they trust that the physician knows.
Yes.
So they just.
You're right.
And you get people like that with their animal, and they just say, okay, he's sick, and get on with it and find the solution.
You sometimes do, yes, but I still think that. Yes, I mean that medicine in Ireland certainly was like that. It was like a doctor, and especially a specialist doctor, was regarded like a god, and he was hardly even he was treated like that. That he would just decide everything, and he almost he kind of figure out what was wrong with you, and maybe didn't even tell you very well what he thought. That was kind of the bad image they had sometimes. I think nowadays, some of the older people might be a little bit like that, but I think when it comes to pets, they've always had to provide the information for their pet, so they are used to kind of saying, to thinking about it, and they've had past experience usually, so they're usually quite good at asking questions. But nowadays, we've got a lot of tests we can use, which sometimes take a couple of days to get results from. We have to send them abroad, maybe things like that. But we can tell them exactly what we're doing, and we can assure them we'll be bringing them back in a couple of days with results and all that kind of thing. So we've got the scientific backup now, which is great.
So you don't mind people asking questions?
Oh gosh, no, it's great.
It's
good. Yeah, it does. It helps to explain it. Yeah.
Yeah. You don't feel like they are taking your place because some people may come with the certainty that they know what and they just want you to prescribe the medicine, but they could question your expertise. Like
that happens occasionally, but not that often actually. Most people, I think respect that you're going to do the best for their animal, especially if they've been dealing with you, so they know that they put themselves in your hands usually fairly well.
Thanks to technology, the treatment, the equipment that you are using have evolved and also developed new terminology with that, and also the way people interact with you also have created new terms.
Yes.
Would there be a term that or several terms or phrases that would summarize, like define a vet work nowadays? What would be like 3 terms or phrases that really describe
a vet's working life, if you like? Yeah. I think the main way to describe it nowadays would be that it's a profession that looks after an animal from birth till the end of its life, really, And in that respect, it geared towards preventative, health measures as well. So we start with vaccinations, obviously, when they're very young, but a lot of it now, would be preventing problems rather than dealing with them when they arise. So with the older animals that come in for any procedure, we do lots of blood tests on them to make sure all their organs and systems are working well, that type of thing,
Yeah. And if you were to train new vet, what would you advise them? What would be the main advice that you would give them?
I think
to be a good vet.
I think learn to listen well to the clients would be a big one, because in theory they should have all the information that you need, and be thorough in all your investigations. They're the two main things, really,
Yeah.
because that's, the history from the client is always vital. And that, if you've got someone, for example, who's got, if it was got dogs commercially, we'll say he might have 25 or 30 dogs. Maybe they're being used for work, protection work or whatever it is, or army work or that. They may not be as well known individually as pets would be. You see, yeah. See, so I think that would be very important.
Okay, and would you have like anecdotes where, because you have so many technical terms, specific terms, but used in a different context, this term could be really funny or misleading or confusing.
I remember going out to I was in a farm one time and looking at, I think, a cow for this farmer. This is down the south of Ireland, and he said to me, "While you're here, would you look at a calf I've got here? He's got an impression." An impression. I'd never heard this word before, you see, and I said, I thought I was being funny, and I said to him, "I hope it's a good impression," you see. And he said to me, "Oh no," he says, "impressions are always bad." So I didn't know what this was. Anyway, so he brought me along to see this calf anyway. And it was a calf who got respiratory distress. It was breathing very fast. And when you see a young calf breathing like that, usually chances are they probably got a bronchitis or pneumonia. And so I examined this calf and listened to him. And sure enough, he had pneumonia, so we treated him with antibiotics. But then I discovered in time that a lot of farmers have this expression, use the expression, "I've got a young animal with an impression." I've never heard it anywhere else. It doesn't appear in any textbook, but it's a one that they use. But it kind of baffled me when I first heard it.
Yeah, it's very confusing because
an impression.
An impression.
Yeah, and my joke was lost on him, I think, that day.
Definitely. Yeah, it could be the fact that when you impress, you have, maybe breathing.
I'm not sure where it comes from, but I've heard it numerous times from farmers over the years. He's got an impression.
And it was always the same.
Always the same thing. It's always just breathing fast. Yeah, that's what it was. But it doesn't appear in any textbook.
Oh, that's an interesting one. Oh, that's a good one. Yeah, impression.
But funny things do happen in veterinary, of course, too. And I had a woman many years ago now in England, and she came into me with she had a small kind of a crossbred terrier. She brought it into me, a female, and she came in and she said to me, "Oh, I just, I'm really interested to know, is it possible that she could be pregnant?" And so she lifted her dog up on the table, and I just started looking, and sure enough, she looked very round, all right, and I said to her, I said, "Why do you think that?" And as I was talking to her, I was just patting the dog, and then the dog just suddenly groaned, and a pup dropped on the table.
Oh.
So I said to her,
okay.
Well, she was pregnant. I said, she may still be as well.
Yeah.
So funny things like that happen, in veterinary,
Yeah, she was quite wide. Oh, wow. That's really funny. You've been doing this job for more than 50 years.
Yeah.
So what would you say that really is fascinating or really good about this job that really made you stay with it for so long?
Well, the main thing is you see animals getting better. That's the great thing when they're ill, and you see, because animals such as dogs and cats are a huge part of people's lives when they have them. They're part of a family, and you see that sadly, which we deal with as well when the end of the life comes, and we occasionally have to put a dog asleep, at the very end when they're at the very end, and the families are usually heartbroken, and they really are, and it's because one of the family is gone. So, but all during the I suppose all the good things we do along the way if they got serious illnesses and we're able to diagnose and treat them, and the animal gets back to health and goes on again and again. That's very rewarding. Always is. Yeah.
Okay. And Is there anything else you would like to add to this conversation
No,
about
I,
your work or your
I think just
passion?
more about the side of the questions that you're interested in is just the use of language and communication, all that. It's just such a huge part of our work in the actual dealing with the client. I suppose the other whole side of it then is just our scientific education to do with our knowledge of biology, etc., to do with the animals. But the communication is just a huge part of it for us. Yeah, and having not just finding out the problem, but just being able to communicate it back and put them at their ease, and so the owners can be less stressed about it. Yeah.
Yes. Wow, that was really interesting, and I had a good time chatting with you and learn a lot about this
Well, there you are.
foundation.
That's great.
Thank you so much for coming and having this conversation with me, Dr. Nicholson.
Delighted to be able to help.
Thank you again. And so that was the Joy and Jargon show, and you were with Dr. Nicholson and myself, Orlan. Thank you, and until next time, have a good one. Bye.
Bye.